Life-stage model from conceptual to senior citizen. We look at all the factors that affect the quality of life. And building infrastructure is one of our key components of people access. We want to have a health facility with 3 kilometer radius. So this one here at Mamanki is building up on the greater picture of what we have for the entire country to make sure that we improve the quality of our infrastructure, solar energy as we have here, human resource, medications, and then diagnostic as we have here. So this is really building on the excellency, the presence, legacy of human capital development in this wonderful area of Mamanki, in Kaffu, Chiefdom, Loko district.
Moving forward, what are you expecting in terms of ownership, considering the fact when development happens, it falls back to the community people, and we have seen the statement made here by the different stakeholders. What will be your word of courage to them in terms of ownership of this project?
Yeah, even before we started the project, we had community engagement, and during the course of construction, we have many times to make sure that we have that community engagement. When you have the community owning the infrastructure, it's up very well for sustainability, which is why we have that intense community participation and sense of ownership of this project. So make sure the building and all the facilities will continue to be in a very good shape for the community to use it for a long time to come.
Finally, how will this address the disparities in the health sector, and how will it address the concern from women, especially pregnant women?
That's excellent, because for pregnant women we have good news. We have been able to reduce maternal mortality by 70% in this country. In early 2014, 2015, it was 1,500 per 100,000 life back. Right now it's around 354. It's going to be going down further. For the women of this country, it's going to be exceptionally good for them, because we are going to build upon this. All of the pregnancies will be captured from here on the national dashboard in Freetown to make sure we monitor each and every one of them. And all of this infrastructure are going to be captured digitally on a handheld device. You know, where are the PHUs, where are the staff components, what facilities, what infrastructure development, everything that's going to be captured for us to continue to maintain them as well as the biomedical engineers.
Okay, thank you very much.
One more question that my colleague is behind. There's going to be a challenge to the community and others' community due to transportation and the feeder road. What is going to be the measures you guys are going to put in place as a ministry?
As we say, when you identify a problem, you have 50% of the solution. So now that we see the roads is bad, but we are going to engage the relevant MDAs to make sure that we fix this road, because we are going to send ambulances here. We ourselves are going to be coming here regularly. So therefore, this road is on a high priority, so make sure that we have access to the health facility.
People are asking, is it going to be free for underage or pregnant women, or is it going to be a cost for them to pay a minimum rate? In
Sierra Leone, we have a free healthcare initiative, and there's a category of pregnant women under 5, lactating mothers, Ebola survivor of etc. That's what those ones are free, and this is going to be leveraged into what we call the Sierra Leone Social Health Insurance Scheme, the SLESHI. That's going to be very soon rolled out to make sure that people are able to pay how much they can, so that they do not suffer financial hardship. So it's going to be a mixed model for this particular health facility.
So plenty, thank you.
Thank you.
So on behalf of the Ministry of Social Welfare, the African Development Bank, the people of Sierra Leone, we hand over this key to Ministry of Health through the Deputy Minister to make sure say this facility it function well for the benefits of the people of Sierra Leone, and particularly the people of Mamanki. And all the other 5 districts where the district chairman themselves represented now. I thank you very much.
Thank you very much, our Honorable Minister of Social Welfare. So on behalf of His Excellency the President, on behalf of the Honorable Vice President, the leadership of the Minister of Health, and the staff of the Minister of Health, and the people of Sierra Leone, I want on this exactly 10 years since the Ebola ended, I want to officially